All right, we have the key injury spotlight on anterior shoulder dislocation. So the shoulder is inherently unstable because this glenoid fossa is extremely shallow. Depending on the person and how they're made, it could be even more shallow than this, but it doesn't really make much of a cup. Where if you think about the other ball and socket joint in the body is the hip, and we have the acetabulum that's really much deeper, and then we have this really shallow glenoid fossa. So it's kind of like what we talk about a golf ball sitting on a tee. That's how a lot of physicians will talk about this. So you have to really have that dynamic stabilization. And when we say dynamic stabilization, we're talking about the muscles in movement around the shoulder, the structures that move around the shoulder. So the common reason or the common mechanism of injury is going to be tension on the anterior stabilizers, which are primarily our glenohumeral ligaments. We have like that bag of ligaments. It's superior, middle, and inferior. So they're kind of like sitting like this, and they kind of are loose, kind of like a bag. So when we're in this position of 60 to 90 degrees, or any time that we're abducted and externally rotated, as you can see, that humeral head is irregular shaped and it just rolls right off. It's going to roll and land right here. So here's your glenoid, and it's going to shift and land right here. This is an anterior dislocation when it lands anterior to the glenoid fossa. Why does it move anterior? Well, if you look superior, it's protected by the acromion process and the AC joint. If inferior, it actually is just not a functional motion, but it actually is, if you have a lot of instability, you eventually will wear out the inferior glenohumeral ligament that sits here. It also protects it on the inferior side. It's usually the one that gets worn out the most. So usually it's common to have anterior instability and inferior instability, but the inferior, you usually don't work in a functional motion that something lands on the top because your acromion is protecting it to shift it out and dislocate inferiorly. So it's just more common for the shoulder to be pulled anteriorly. Posteriorly, you're protected by the rotator cuff and the scapula, so it's very difficult. Usually the most common way to posterior dislocate is to have a grand mal seizure. I had a roommate that had epilepsy, and every time they had a seizure, a grand mal seizure, they posteriorly dislocated. And so for anterior dislocations, basically you have something acting a force. It's usually a rotational force acting on the humerus. So remember we talked about in the pathomechanics, you have this long lever arm. And we talked about earlier on in this class that if you're applying force further out away from the joint on the lever arm, the more rotational force and torque you're going to have on the shoulder. So if your arm is out, stretched all the way out, especially like in football when you're reaching for an opponent, and that opponent keeps running and your arm is stretched back, it's going to externally rotate and extend and abduct back. And it's just going to, that ball on the golf tee is just going to slide forward. And so that longer the lever arm and the force on that longer lever arm is going to create more rotational force. And the ligaments are not built to withstand a force like that, a traumatic injury like that. So it pops out. As far as like intervening things that you need to understand is that when it pops out, there's usually not any neurovascular issue because the axillary nerve and the radial nerve are running down here. So unless it was like a really severe traumatic inferior dislocation, you're usually not putting compression on those nerves. So as long as you do what you're supposed to and only trained clinicians that are working within their scope of practice by their state practice act laws, those who are the only ones that can reduce the shoulder, and they have to be under the supervision of a physician who says that you can do that specific joint reduction. So not anyone can just do a shoulder reduction. Please do not do it if you're a coach and you've seen it done. Do not do that. So if you're trained to do it, then it should reduce fine without any kind of neurovascular. The vessels and the nerves are running under here. But you always ask, nerves would be tingling sensation. Vessels would be feeling cold. The blood capillary refill, when you fill, it doesn't fill back up the way that it's supposed to. So, but anyway, when you're talking about this injury, and we're talking about the injuries that can happen from it, when it comes out, you can actually rip off a piece of the humerus where the inferior glenohumeral ligament basically tears off. That's a Hagel deformity. You also can have the slap tear at the top, the superior labrum. You can also have a Bankart lesion, which is the posterior and inferior part of that labrum rim can also tear off. So the labrum is the most common suspect. So we often have people after they have a dislocation go see the physician, see if there's any kind of secondary injury. They usually need to order an MRI if they suspect anything with the labrum. So clicking, popping, pain, especially at night. Those would be indicators of a labrum tear, because if anything is wrong with the labrum or these ligaments, and a dislocation had caused that, it's more likely to happen again, and it will keep happening. Some people just have really small fossas and they will never have that stability and they keep dislocating. There is a procedure called the Latarjet, Latarjet. It's French, where they take a piece of this coracoid process and they chop it off and they put it here to create a bony stabilizer. It's a really cool procedure. If you ever get to see that, only usually specialists who do that a lot are allowed to do that or should do that. If you have any questions about this, please reach out, go back and watch the video, and then play the games and make sure you understand all these concepts on the study guide.